sharing my video with you, which is absolutely different. It is not a cataract, but can you see the screen?
Yes, we can, Namrata.
Yes, we can see the screen.
Wait. There's something wrong. I can't. Okay, so this is a story or tale of two eyes and two lives, which I'm going to share with you today. So this is a lady who came to us 28 weeks pregnant lady with bilateral peripheral ulcerative keratitis and completely blind. So we gave her, there are risks which outweigh the surgical intervention. So we medically managed her on topical drops and topical immunosuppressives. But 2 weeks she came later and she had already progressed further. So we planned to do a bilateral sclerokeratoplasty, and patient was not cleared for surgery in view of high chances of preterm labor as well as fetal lung maturity. So IV steroids were given for fetal lung maturity, and finally the day of the surgery came. Notice that she's being accompanied by her husband because she's completely blind and cannot come on her own. And this was the situation when she was there on the table. So the iris, there's a iris prolapse which is there, and we had teams from several departments of our institute, which included the gynecologists, and included the neonatologists who were looking after the fetus because the lady had still not delivered, the anesthetist, and this is the fetal monitoring which is going on here, and the anesthetist who's looking after, because we had to do it under general anesthesia, and of course us operating. So we did surgery sequentially one by one, and it took almost 5 hours to complete the surgery. The peritomy was done in both the eyes first, followed by the cautery that was done to cauterize the bleeders. Subsequently, the bands, the fibrotic bands and the membrane that were there were removed, and the iris was gently dissected away from these membranes because we wanted to preserve as much of the iris as possible. And the lamellar dissection was also done. The dictum of such cases is that as much of iris as possible should be preserved, and also give mannitol in these cases because there's a tendency for the lenses to pop out. So the fibrotic membranes were removed very gradually, and we've described this technique already earlier, and this has been published, layer by layer dissection of the pannus and the overlying corneas in therapeutic keratoplasties. And then when the entire dissection was done, the bilateral grafts were planned. These were taken from the same donor because we did not want to increase the rejection for this patient, because we wanted to give the antigenic load only from a single donor. So from the single donor, two sclerocorneal grafts were used, 10-0 monofilament nylon sutures were given. And of course, in such cases, there is always bleeding, which is there, and it was there in this case also. And you can't do with 16 sutures, you have to apply many more sutures here because of the fact that it is a large graft. And the story actually starts after a transplant in such cases, and this was also monitored on the intraop OCT microscope. And 2 months later, the lady came like this with the bilateral grafts, and although she was still on topical steroids and topical antibiotics, and we did not and this is the way. So it is a story of two eyes and two lives. The lady came with the child in her hand, unescorted by anybody. Thank you very much for your kind attention.